we've done our job well when you don't need to come back and see us. And actually, I would say that goes for medical nutrition too. And I think that is something our team really strives for all the time, is that patients come to just say hi, not to need to be on our schedule. And so we take that very seriously and work very hard to really, again, empower them. And I think that's why I love rehab so much, because it is an exercise in empowerment. And I always have said, if I've done my job, you're only coming to say hi, not coming to be treated. So, yeah.
I love that point, and I would agree. We want to get you on your way and make sure that you're able to know what you need to do to get better and move on. My name is Kerry McMillen. I am a registered dietitian and a certified specialist in oncology nutrition. My role here is I'm the Director of Oncology Supportive Care and Screening.
I'm Lexi Harlow, and I manage rehabilitation services here at Fred Hutch. I am a physical therapist, and I am certified in treating lymphedema as well. Rehabilitation services at Fred Hutch encompasses several disciplines, and our focus across all those disciplines is helping to maximize patients' function and their quality of life, being able to do the things that they want to be able to do. On our team, we have physical therapy, we have speech language pathology, we have a rehab medicine service, and we'll be adding some psychology services to rehab later this fall. And all of us work to try to meet really the patient's goals around what they want to be doing in light of what they have been faced with cancer, either through the cancer itself, what it's done to them physically, or also the treatment. And more often it's really dealing with the treatment side effects that we work on. And so when patients come to see us in rehab, you will find that we are asking them so much about what matters to them, what's important to them, and what can we help them with. So obviously we know there are common issues that come with certain treatments and certain diseases, but we really try to tailor the care to what's important to that patient or their family or the caregivers. And so you will see that be really obvious in our visits. And I would say in both of our areas, we were very much focused on, empowering patients to help themselves. So I think so often patients come in to our center and things are done to them from a treatment perspective. But in both rehab and medical nutrition, we give them options to be able to help themselves and empower themselves to get better and to feel better. And that's incredibly rewarding to us as a team.
Absolutely. When patients come to see a dietitian at Fred Hutch at any of our locations, they are similar to the rehab discipline, assessed as an individual. And that's really important because the medical nutrition therapy needs for a cancer patient really vary across the cancer continuum. So what we'll say is important in prevention is going to be slightly different than what we might say during active treatment versus what the goals of care are in survivorship. So again, we really try to match that individual patient preference of how they eat, what's important culturally, look at health-related social factors like food insecurity, et cetera, and match it to what's evidence-based for their diagnosis. We want to make sure that people are getting information that's science-based. We often joke that we're the ones who translate science to put meal recommendations or snack recommendations on your plate. And so we will give you that degree of education versus a blanket statement, which you might hear on social media. And so we will also be doing a lot of myth busting with patients around, should you be only eating this or never eating Y? And we don't like those types of recommendations because they're rarely evidence-based.
Our team is very skilled in physical therapy, speech language pathology, rehabilitation medicine. But what is different about what we do is we see the patient through the lens of oncology, which is a very distinct skill set because we have to be able to understand their journey, what they've been through physically, what they're maybe faced with looking forward, and being proactive and being able to sort of take the rehab tools that we have and then apply them to that situation, again, focused on the individual needs of the patient. So the reason why it matters is because of that, because not every therapist, not every physician really understands that to the degree that our team does and how it impacts them functionally. So that gives us an edge, if you will, in helping them to get stronger, to get better faster, because we understand all of those aspects of the actual oncology care.
And I would say that the nutrition lens is equally just focused from that oncology perspective. And we are trained in oncology nutrition, so that allows us to be proactive in managing a patient's care. So depending on what regimen you might be on, we would be able to predict what you might have coming down the line. An example of that is certain chemotherapy agents make you sensitive to cold flavors. Oftentimes when people think about, oh, you're going to have nausea, just drink smoothies. Well, if that feels like a block of ice is being put in your mouth, that's not very comfortable. So we really want to make sure we have very tailored recommendations. Lexi brought up earlier empowering. We want people to feel empowered, that they have ideas of what to try, what to eat. And again, similar to the rehab discipline, we're really focused on maintaining nutritional status, which is about maintaining your strength. And it pairs very nicely with rehab in that we're both very, very motivated to maintain function. And that's part of the collaboration between our services as well, as we often pass patients back and forth, because we know that you can't just exercise alone to build muscle if you don't have the nutrition component, and you can't just eat your way to building muscle. You've got to have both disciplines involved. So it's really a pleasure to have our teams be so connected.